Welcome to Ask Sid, the official podcast for Sydenham Clinic. Today I come to you from our flagship location here in Beverly Hills. I am so thrilled to bring different guests onto the podcast so that we can talk more about our 7 pillars of health, and we can go deeper into your genomics, your gut health, your hormones, your sleep, your nutrition, psychology and physiology. So let's bring it on. Welcome back to Ask Sid, and as you can see, I'm back in Beverly Hills at our brand new clinic here, and today's guests are super special. We have 2 periodontists, Dr. Ziv Simon and Dr. Lloyd Herman. Thank you so much for joining us today.
Thank you for having us.
Thank you for having us. Great to be here.
Yeah. I introduced you as periodontists, and I'm sure half the people don't know what a periodontist means. So can we start by please explaining, because I know you're a dentist, but like there's super specialization even in the field of dentistry.
Sure. So I'll start. So a periodontist is a type of dental surgical specialist. So you have your general dentist, like a general physician, and then some dentists prefer to specialize and become either an orthodontist, an endodontist, which is a root canal specialist, an oral maxillofacial surgeon, which does more jaw surgery, oral medicine, oral radiology, and there's a periodontist. So what is a periodontist? It's a specialist that deals with all the structures that support the teeth. That's gum and bone. So peri is perimeter around the tooth. So when there is gum disease, gum recession, too much gum tissue, gum cancer, loss of teeth, that's all as part of a specialty of a periodontist. And our practice is right here next to yours.
In Beverly Hills, yeah.
2 minutes away.
I want to know all about your practice, because your practice is unique. Like there are a lot of dentists here. Like this is dentistry central, beauty central, right? A lot of people focus on the aesthetic part of dentistry, but I see you also have a holistic take on this. Please, Dr. Herman, tell us more about your unique approach.
So holistic dentistry, it combines the science-based research along with kind of cutting-edge current technology that may not find in the old literature.
Right.
And so trying to combine that with techniques that are time-tested and proven. So it also looks at the whole overall health of the patient.
Right.
I think that most of the time we're leaving that out, and we're just focused. We're been limited to kind of the mouth.
Right.
And so I try to incorporate a little more. Not to say that Ziv doesn't also incorporate this, and probably the way we talk to each other, we educate each other about certain aspects, and we're always having good discussions.
Right.
And so it's a matter of, first of all, educating the patients. And a lot of the patients come in pretty well educated. They're seeing naturopaths, and they're already coming for a certain reason. A lot of them are seeking help with, let's say, root canals that they either have infected and they need to get them out, or they want to have them taken out safely.
Right.
They may have situations where they don't want any metals in their body, so they want a ceramic alternative. And a lot of the conventional dentistry or conventional periodontics is more towards the titanium.
Right.
It's zirconia or ceramic is a little more technique sensitive. There's a few more things that you need to know about that. So a lot of people don't want to do it, and I love providing these patients an
options. Yeah.
Yeah.
And it's not one size fits all. That's what here at Sydenham. We're so focused on precision personalized medicine, and I like it that you're doing precision personalized dentistry, where each patient's unique. And earlier you were telling me you have some patients who do not want antibiotics or who want to heal post-surgery using alternative therapies, and you're very open-minded.
Yeah, and he sees a lot of patients with Lyme disease.
Interesting.
Yeah, so
Lyme is the mold exposure.
Right.
Which it's tough because even the naturopaths have trouble getting them well. But they do say, hey, you need to go see the dentist because there's certain things in your body, in the jaw, that need to be looked at in order to get you fully healed. And so sometimes...
Can you talk a little bit about that? Because for those people who have different autoimmune conditions, somehow, you know, like, because we focus a lot on the gut, right? Like at Sydenham, we focus on autoimmune gut. Like people have made that equation, but this is interesting. Oral health and autoimmune diseases. Please talk more about it.
So, you know, first of all, you're talking about the microbiome. We have a microbiome in the mouth. So for a long time, we have treated it like, oh, okay, we want to annihilate everything in the mouth, you know, disinfect it.
Antiseptic.
And so, you know, you do need to get regular cleanings in order to take the buildup off the teeth, because you don't want the plaque will harbor the bacteria and all that, but you want to be selective in the way you do it. And it's like an atomic bomb going off when you use like these alcohol containing mouth rinses.
Right.
And, you know, the worst thing that you can do is probably tongue scrape and then use one of those alcohol containing mouth rinses that just wipes out everything, because that microbiome on your tongue helps to form nitric oxide in your body. It helps in the pathway of that. And so when you scrape off your tongue, you expose all that bacteria, and then you use that mouth rinse, and it's wiping everything out.
Wow. Are you suggesting we don't scrape?
No, it's in moderation, because Dr. Herman mentioned a nuclear bomb. You don't use a nuclear bomb when you have a small enemy.
Yeah.
So we got to remove enough of the microbiome in the mouth that is harmful and let the body do itself. We strongly believe that the body knows what to do. We just don't have to, we shouldn't stay in the way, we shouldn't do the wrong things. But the body knows how to heal, the body knows to establish the gut biome, the mouth biome. We just shouldn't do stupid things.
To strip it off completely.
Yeah.
So what is your recommendation, like for preventive health?
So what I feel is probably the best way to, especially, so first of all, when people always ask, like, when should I brush? When should I floss? Mm-hmm. Should I tongue scrape and you know, mouth rinse and everything? So my protocol would be to, first of all, you want to I think tongue scraping first.
Before you brush your teeth.
Yeah, not too much. And you could either do it with like a copper tongue scraper, or a toothbrush, a separate toothbrush from...
Not the same toothbrush that you use on your teeth?
I don't think so.
Not the same one. Plus, you don't want to brush your tongue. That's one of the biggest mistakes patients are making.
Wow.
They're just spreading it all around. You want to actually, let's say this is the tongue, you want to go from the back and scrape towards the front. A couple of times, not 20 times, like 2-3 times.
And a separate toothbrush for your tongue.
Yeah. There are some toothbrushes that have the other side. We recommend a tongue scraper. Can be either be plastic or the more metal one.
I think copper's the best.
If you can copper.
Antimicrobial.
But not excessively.
Yeah.
Again, the body knows what to do. You just need to make sure you don't do the wrong things, and your mouth is going to be pretty healthy.
And then you'd want to floss, because you want to be able to get all that stuff that's built up between your teeth. You know, you could use a water flosser, you could use toothpicks, and then brush, because then you loosen everything.
So you think floss before you brush?
Yes.
That's the basics, because when you floss, you get all the crud in between the teeth out, and then the brush gets the rest, ideally an electric one.
Yeah.
But that's a very stinky process.
But it will unstink you, because it will get you the healthiest.
Wow.
That's what science has shown. That's the right sequence.
Okay, now that we're really going back to basic, is there a right way to brush your teeth?
Well, actually, that's a great question. So a lot of patients do ask us that, because, you know, conventionally, patients didn't really understand the way to brush, and they might have caused gum recession. So, you know, that has been a way that, you know, people have harmed their teeth. So it's been taught, you know, we want to work away from the gums, and especially with electric toothbrush, you can actually, you know, work it like this away from the upper. Like if you're using the upper, you go like that. And then also what they have is they have timers, and they have little pressure sensitive pressure sensors, and then the light shows up so that you're not brushing too hard.
And there's Bluetooth. Most brushes now, the electric ones have a Bluetooth, so it syncs with your phone.
Okay.
You can get a score.
I love it.
A lot of great things to recommend. I mean, honestly, you don't have to buy oral hygiene equipment for hundreds of dollars. It's the basics works the best. A manual, if you can afford an electric toothbrush, even better. Floss, tongue scraper, and then we can talk about the rinses we recommend for the biome.
Yeah.
What type of rinses?
Right. Let's
Because
get
a
to
lot
that,
of people
because-
like to use anything off the counter, because when you go to, let's say, the supermarket or the pharmacy, you're going to pick what they want you to pick.
Yeah.
Whatever is in the eye, whatever has
Or what's on TikTok these days. Social media influences a lot of your decision making.
So you know all about that.
And first of all, the toothpastes are important because you don't want all these chemicals in there. Even sometimes the essential oils might kill all the microbiome. You don't want the SLLs they're the surfactants, and they make it bubbly and all that, and that's an extra chemical that also wipes out the microbiome. I feel that these days the hydroxyapatite toothpaste, as long as it's a reputable type, that's important because that helps remineralize the teeth, and it doesn't harm the microbiome.
So what should we be looking at when we read a toothpaste label? What are some of the things that we should be trying to stay away from or look for as an ingredient?
So, I mean, one of the things, I know it's controversial, fluoride is probably one of the biggest things. I think that the hydroxyapatite, can be a great substitute for that. I don't think you necessarily need the fluorides in the toothpaste, especially if you're going to swallow it. It can be harmful to your whole system, and it also it can kill the microbiome both in your mouth and your gut. So you want to use things that are as least toxic to your body. So like coconut oil is good, and it could be in there. It could be something that is like baking soda, but you need to make sure it's not too abrasive.
Right.
Something that's going to brush off the particles and help, like an abrasive particle.
Yeah, without getting into the chemicals, it's good to see that it has an ADA seal, the American Dental Association. Not that this means it's the end to all, but at least this is a
version.
Well, but not all of them have gotten.
Not all of them are great.
No, but not all of them have been sent there to be approved. So some of the good ones that are currently there, they're not even.
Which one would you recommend?
You know what? I haven't looked at the exact.
Which one do you use at home?
I'll use. Depends on. I try a different one.
I'll tell you what I use.
Yeah.
Whatever my wife brings and puts on the counter. That's what I use, because it's either Crest or Colgate. They're all in my mouth, in my patient population. They work very well.
They do?
I don't like
So that's okay.
I wouldn't.
I love a healthy debate.
We differ. To me, it worked well. I have minimal cavities. I had my cavities when I was 7 years old, when there was no fluoride in the water. Speaking of fluoride, but now there's no more cavities. Now I'm dealing with other, health concerns. But the thing is, not to overdo things.
Right.
Not to, when you brush your teeth, you don't have to put a big glob of toothpaste on it. Just a dab. We call it pea size.
Okay.
Just a pea size. You don't need it. Let's say.
So more is not better.
Not necessarily. If you're suffering from gum disease.
And that's the next thing I wanted to come to. Like, prevention is great. We do this daily regime. But now coming to gum disease, a lot of people get diagnosed so late with gum disease.
Yeah.
Tell us a little bit more about it.
So first of all, gum disease, for people that don't know exactly what it is, it's a chronic inflammatory condition of the gums around the teeth. And it's very prevalent. Guess the percentage in the world. It's the second most prevalent disease in the world.
After
Dental cavities. Dental cavities is the most prevalent disease in the world.
Right. Dental diseases, we're just talking about.
Well, cavity is number one, gum disease number two. 90% of the population has some sort of gum issue. That's why
Because it's inflammation.
It's inflammatory. So what's the big deal? So what if the gums bleed? The problem is that when there's inflammation of the gums around the teeth, then the bone gets inflamed. When the bone gets inflamed, it starts to melt away. And when it melts away, you lose the support for your teeth. And when you lose the support for your teeth become wobbly. Then you can.
How long does this whole journey take? Is it years? Is it months? Because is it too late when your gums start bleeding?
No, that's the first sign. That's the first sign of that alerts you that something's wrong with the gum. That's the body's way to tell you, hey, something's wrong.
So it's not okay to have any bleeding.
Very minimal bleeding. If you injured yourself, or let's say you slacked off on brushing and flossing for a day or two, you might have some bleeding. But chronic bleeding, swelling of the gum, bad taste in your mouth, loose teeth, not feeling comfortable with this complex are the first signs of gum disease. And then you have to see a gum specialist, which is a periodontist.
Right.
Yeah. Our practice, for example, has 4 periodontists. So it's like us times 2. We've been there since 1980 here in Beverly Hills.
Here, wow.
Same address, not us personally, because we were kids back then. But our founder is still in the office. So the same practice, same address, because this problem is very, very common. So there's a lot to unpack here.
Yeah.
But we talked about rinses. If you have gum disease, you don't have to make it complicated. The most common thing that most people know about is salt water rinsing. This is something our grandmas used to know. So salt water, rinse your mouth. It reduces inflammation, reduces the swelling. When there are
toxins.
Yeah.
Pardon me?
Pulls out toxins.
Pulls all the toxins out, mostly against the demon. Then there are other more medicated ones.
And obviously, if you have a patient who works along with a nutritionist or has like a clinic like Sydenham, and they fix the root cause of the gum disease, I think it would help vice versa, right?
For sure.
Do you work sometimes to try and work on the gut, or is it something that you've started delving into because you feel like you need to help your patients?
Yeah, I think that, first of all, we're dealing with patients that have a history of they take antibiotics.
Yeah.
And so you need to rebuild it, afterwards. And so it's important to support that in overall health. You have breakdown of certain, or the production of certain minerals or certain vitamins in the gut. So if you lose that good population, you're losing that production.
Right.
So back to Aanchal's question about the 2 direction, the mouth and the body and the mouth. So what we know now from research is that it's a bidirectional effect.
Absolutely.
So let's say you have a systemic condition. Let's just pick a very common condition, diabetes. Extremely common, in my opinion, very preventable for a lot of people because of lifestyle.
We agree.
Right?
It's preventable, it's reversible.
Yeah, there's a lot of things to do. So one of the first signs of diabetes can be found in the mouth. More gum disease.
Thank you. Not a lot of dentists, take that approach, that you could actually be referring them back to their primary care doctor and say, look, something is wrong. Even heart disease
so we would refer a patient to your clinic, for example, to get a full blood workup and see, let's say, what's the A1C, which is a measurement of how controlled your metabolic or glucose metabolism is. They researched a tribe of native Indians called the Pima Indians.
Interesting.
And they have the highest percentage of type 2 diabetes, just genetically. That's in their makeup. And they found the connection with gum disease. And they did all the research on that.
So it was the gum disease causing the diabetes, or was it the diabetes causing the gum disease?
It was connected. So what they saw is patients with diabetes have more gum disease. If you control your gum disease, you can lower your A1C and you can get your diabetes in better control. So it goes both ways.
Right.
If you see a patient in your clinic here, amazing clinic, by the way, beautiful.
Yeah, it's beautiful clinic.
If you see a patient with diabetes, I would say also control all the medical parameters, but also the dental parameters.
Yeah.
So the diabetes
it could be lifestyle, because it could be what they're eating. We spoke about sugar and processed foods.
Yeah. They like a lot of carbohydrates.
Yeah, and these conversations don't really happen in a dentist's office very often because you're just fixing
Even in the medical,
disease.
even in the medical system. I mean, they tell you, okay, we're going to put you on metformin. So instead of actually counseling you, hey, how are you going to stop this? How are you going to reverse it?
Yeah. So that's things have changed in medicine and things have changed in dentistry.
Yes.
There are the old school physicians and dentists that are more technical, write prescriptions, don't even look at the patient, just look at the computer.
Fix a problem.
Yeah. And then there is a new type of doctor, a new type of dentist that looks more at the full
The
body.
person, human being, their lifestyle.
Yeah.
Holistic.
Exactly.
Yeah. And I was holistic before I even met you, but now there's more, a lot of patients come to see us because they want that type of approach.
They want to be seen, they want to be understood. And you want to go to the root cause, not just fix it and then come back when it's broken again.
A lot of the medical system has given up on these patients, and so...
Well, we're here to bring about a change, like-minded people, and it starts in Beverly Hills. Well, not to miss, we have our pet director, Chloe. Sweetly, she's cuddled up to you.
She's very comfortable.
Yes.
Well, I have two golden retrievers, so
Oh, those are big dogs.
So
She's sleeping. She's not bothered about the podcast at all.
I think she likes the conversation.
I think she likes you.
It's very soothing.
It is very soothing. That's the other thing. A lot of people are scared of going to the dentist.
Yeah.
It's like they get anxious or they have phobias of going to the dentist.
So a lot of it comes from trauma, from previous trauma. So if you grew up in the old world countries, there was no attention to how the patient feels. There was no what we call TLC.
No.
We in Beverly Hills, we're all about TLC.
Yes.
So you got the trauma from when you were a child where, for example, when I had cavities filled when I was 10 years old, there was no local anesthetic. There was no injections. Now dentistry is painless. Dr. Herman has all sorts of other ways to calm the patient. Now, so we use sedation if needed to, but there's other ways where you don't need sedation.
Yeah, I'll put some essential oils on their pillow and
on a comfy blanket, right? You put it on the blanket.
Yeah, and so they have that, the aromatherapy that helps them to relax their nervous system.
Which one do you use? Because you have specific, for every patient, there's a specific.
It has some lavender and a few other calming.
So you know your patients.
Yeah.
And you know what they might need before you just start going in and drilling.
So dentists used to be technicians. We are very good with our hands. Obviously, to be a dentist, to graduate dental school, you have to you have very good manual dexterity and a surgeon, even more in surgery. However, it's now coming back that the dentist is also a nice human being. And connects with you. So it's all about the frequency and the connection with the patient. And then
it's very intimate. You're going into somebody's mouth.
It's pretty scary, especially when you do surgery, or you might lose a tooth, you might need to treat an infection in the mouth. So so if you are well informed, and that's also in our new book, how to choose a doctor, how to choose.
Well, that was going to be one of my questions.
What questions you need to ask your doctor to know that this is the right person. But the conclusion, I'll give you just the conclusion.
Give us a sneak peek. So what is the new book you both are writing on?
The sneak peek of that chapter, how to choose your doctor, is at the end of the day, it's your gut. What do you feel about this person? For example, you meet a nice person.
They have a good microbiome.
Hopefully. We met Aanchal. I met Aanchal a few months ago. There's a certain frequency. There's a certain chemistry right away.
Yes.
You can't even explain it.
Yes.
I met my wife. I knew this is going to be my wife. There was not even a question. So
and there's some people you meet and you're like,
exactly. So there has to be a very good connection between the doctor and the patient. And then, not surprisingly, there's less inflammation. There's better recovery. And there's a great connection because it's not always an easy road. As you know from this clinic, patients are coming in with severe conditions. And it's not an easy road. It cannot be fixed in one day. So there has to be a very good connection between the patient and the doctor so they can walk this path together towards recovery.
And the oral health will keep changing. I don't know if you've followed patients over years or even a decade.
We've been around, you've been around 30 years. I've been around 25 years in the field. So we have, a lot of experience with patients we've treated, decades ago.
And different problems come at different. So, having somebody who looks at overall health. Sometimes you have a conversation in a dentist's office which you might not have in your, endocrinologist's office. And how the whole system gets connected.
We work a lot with endocrinologists, specifically because of diabetes, thyroid disease, bone metabolism, because we deal with dental implants, with
Right.
extractions, bone grafting.
Right.
If the patient is deficient in vitamin D, or they take
K2.
or they're taking vitamin D and they're like, oh, they don't even know what's a K2 supplement.
Most people don't even know.
Cardiologists don't know about vitamin D and K2. Like, I don't know, this reduces heart disease like by 50%.
Do you know why?
Why?
So the K2, the D3 helps to bring the calcium into the blood.
Right.
And the K2 helps to bring it out of the blood into the right places in the body. And so if you don't have sufficient K2,
Right.
it's going to stay in the artery.
Too much calcium in the bloodstream, and we don't want that.
No.
Yeah.
And here we do genomic testing. So a lot of the times you come to know that like my husband has it. He has a gene where he holds on to calcium in his body, right? So again, you have to take like a broader picture and go to the root cause. Like, why is this person holding on to calcium? And like you said, you work with endocrinologists. There's a whole generation of women that have gone without hormone replacement therapy and they're getting osteoporosis. And I'm sure that bone loss has got something to do with the structure of the mouth.
That's a very interesting comment, because osteoporosis is a huge topic in dentistry for the past 20 years. Now,
Really? And people who just go to a rheumatologist or...
So it's very interesting.
And they start taking the drugs that are trying to preserve.
Osteoporosis medication.
Yeah, trying to preserve the bone.
Phosphonates.
And the problem is once you start taking those medicines, very hard to heal after. That you can get a bone infection very easily.
So
Talk to us more about it, because this is new and
I want to spend a minute on that, because that's
Please.
important for your patients.
Please.
So there's a group of medications called bisphosphonates. And these medications, what do? They make your bones stronger, because they slow down the osteoclasts, which are basically cells that eat bone. It's like I call it Pac-Man. It eats the bone. So great, it makes the bone stronger, less prone to fracture.
Right.
But what happens then? God gave us that.
And it also densifies it decreases the vascularity inside the bone. So that's what higher essence.
Yes, you're 100% right.
Yeah.
So
So there's less blood flow in the...
that's one, but that's really not the point. So I'm just saying it the way it is, because
I love it.
the point is that osteoclast, God gave it to us. He gave us this beautiful machine.
Right.
And so now we doctors, we don't need that osteoclast. What we actually do, for wound healing, when you have a wound, you need a cell that eats bone and creates bone turnover. All of a sudden, the periodontist goes in and does a surgery, and the bone doesn't heal, and you get something called ONJ, which is osteonecrosis of the jaw, which sounds terrible, but it does happen. So one of the most important things, and that's the message now, if you're going to go on a bisphosphonate medication like Fosamax, Boniva, Prolia,
My grandmother's on Prolia.
see the dentist first to make sure that you don't need any surgical intervention. Like, you're going to lose a tooth, you need an implant, you need a root canal, you need anything that is more dentally related, because you want to do the dentistry first and then go on the medications later. Because it is an important medication for some people, because we know that hip fractures at a certain age is like...
What about the jaw locking? Is that to do with this, or no, it's not related?
No.
It's not.
Talk a little bit about that, because a lot of people suffer from from lock jaw, open lock, closed lock.
Right.
Yeah.
It happened to my grandmother. She's on Prolia. I'm wondering if there's any link.
Well, I mean, in one way, if it happens later in life, it could be...
94.
Yeah, well, no, I'm going less. I'm saying the jaw locking, if it's later in life and it's after you've had some bone loss, it could be that the whole...
of arthritis.
Yeah,
she has arthritis.
Yeah. It recontours, and so then it doesn't open and close so well. But then there's also TMJ problems that people may have, and that's a whole topic in itself. It's
I mean,
a lot of stuff.
A lot of people don't know the joint, the TMJ, the temporomandibular joint, is the most complex joint in the body. There's no joint in the body is more complex than this one.
Why?
Because it has many functions. It has a ball and socket, like the hip.
Or the shoulder.
Right. But when you open up, the jaw dislocates by design. Again, that's how God made us. So in order to open, it goes in the ball and socket and then moves forward. and it's connected to ligaments. There's fluid inside.
Yeah.
There's cartilage. There are muscles. There are two types of bones that connect.
And it's so close to your eyes and brain, and
A lot of things can go wrong. Like if you have muscle tenderness, for example, I was treating a patient this morning, and she locked. She was sedated, and she locked on us. How am I going to do the surgery? So we had to bring her under, relax the muscles so she can open,
you have to unsedate her.
get her deeper.
Oh,
Get her deeper, so everything relaxed. So we had to
sedate her more.
intubate her so she can relax her jaw so she could open so I can do my procedure. So people look at dentistry as it's just a tooth fixer.
No.
A dentist is a physician of the mouth, especially at the specialty level. We get additional training. Then you interact with all the other physicians. You interact with the doctors are here in this practice.
Right.
With the goal for the patient to do better ultimately versus just piecemealing the human body. I take care of this, you take care of this. We want to treat the whole body as a whole.
So we got this derailed from the question
of
of
course.
how to choose the dentist and what your new book is about. Can you outline what are some of the things? Because we're all about early detection and prevention, right? So I think if you could educate us in some of the things that people come to you too late and they should be coming early to, and what should we be going to a dentist for?
I'm just going to mention the title. You're going to talk more about the chapters, but in the synopsis.
I like the
I
I like the tango between the two.
we-
By the way, I found my first tango dancer in LA, and I'm so excited. The next time, maybe we can do a tango podcast.
Well, we did.
did do a tango.
Before we started this podcast, we actually did a little tango.
Yeah, that was his introduction. He didn't even say hi to me. He came in the tango embrace, and we did a little dance.
Amazing, and you did very well, both of you. Back to the book. The title of the book is The Healing Path. The Healing Path, because life is a path.
Yeah,
Healing is a path.
yeah.
And the subtitle is How to Recover from Surgery. And it's a very simple book that Dr. Herman and I wrote, actually recorded in one of our carpools to Beverly Hills. And the idea is to hand this book to every patient. So not only are they getting a precise procedure by us,
Right.
but they know what to do at home on different levels. So maybe talk about some of the highlights.
Yeah. So I mean, state of mind. It's very
where it starts.
important.
Yeah, where it starts.
Yeah.
That's one of the big things. Is if you believe that you're going to heal, you can create a lot of. Or if you believe, let's say you're not going to
Not
heal,
going to heal.
you see a lot of those patients that
Who live in
that
fear, who live in fear.
There's a name for that. It's called nocebo. There's a placebo effect.
Ah,
That means I'm thinking it's going to help me, and it will, and it's scientifically proven.
Yeah.
But just as equally proven is the nocebo effect.
whatever you do, I'm not going to
Yeah,
get
there's a great book. If you're if you love reading books, the expectation effect. So if you're thinking out of a fear mindset and you're thinking that it's not going to work, I don't trust my doctor, I'm always getting complications, nothing works out for me.
Yeah.
Guess what?
Yeah.
Your inflammation is going to go up. You're not going to heal well. So that's called
And it's not
nocebo.
the doctor, it's your mindset.
Often, yeah, very often.
and the cortisol. You're going to create that
Through the-
cortisol in your body,
Yeah.
and that causes inflammation.
So this is the first chapter.
That's the
mindset?
first. It's mindset. How to have the right mindset. Then we go through nutrition. What are the things you want to eat and drink before a procedure? How to prep your body before. We talk about intermittent fasting. We talk about hydration. By the way, these are very simple things.
Absolutely.
That everybody can do. So the book is basically a distillation of his knowledge, my knowledge, the other doctors in the office,
Right.
and things that we've used for many years. Because if there's somebody in the dental field that knows about healing, that's a surgical specialist. So we see that the patient heals very well, or some don't heal very well, and we were able to see what were the factors. Yeah.
What's the next one?
What is the next one?
We have a whole chapter on supplementation, the exact supplements specifically for healing. And it's not an encyclopedia where you have to sit and study it for weeks. It's really quick and distilled, and we want to make sure that
If that chapter's not done, you can talk to our team. Maybe they
Yes.
can tell you what's the latest,
I
greatest.
want you to review it before it comes out.
Yes, our medical team can definitely chime in, and because it's changing. It changes every few weeks.
We want to even have it where you have an update on the internet so that that book is updated all the time.
The next chapter is how to pick your doctor. And I know it sounds trivial. You go by a list, or you go by your insurance, or you go by a friend, or the bottom line is you got to meet the person, that doctor, that professional with advanced training, and we give you the actual questions you need to ask. For example, do you use growth factors in your procedures? Do you use that? Do you use exosomes?
Do you use, so cool.
Do you use lasers? So based on those questions, and again, we believe that communication between people.
Talk about the growth factors, because a lot of time, not all doctors use growth factors in surgical procedures. I mean, our nutritionist, she was telling me all about how she got foot surgery, and one of the prime reasons she chose that doctor was because he uses growth factors.
Exactly. So it's important because number one, you're not putting the doctor on the spot, but you want to gauge, is this doctor up to date with the recent science? Do they believe in that? Do they use it or not? Growth factors, specifically the bone growth factors, were discovered at the late 90s.
Yes.
At UCLA by a doctor named Urist. He's no longer alive.
Oh, it was in UCLA?
UCLA. He discovered the BMPs, bone morphogenetic proteins. So I happened to be a student at the time, and I did my research on BMPs. So that was a big hype and a big thing, and it worked really well. But it was very cost prohibitive. So any surgery that a patient would undergo, they would have to pay an extra amount just for the growth factors. So now in our practice for the past 15 years, we no longer need to use a product off the shelf, but we use the patient's own blood, which has BMPs and has those growth factors. And specifically, we use platelet-rich fibrin. So maybe you want to explain how we use that.
So we draw the patient's blood and centrifuge it down, and we get a membrane out of that, and we can mix it with the bone grafting material, and
so you inject it in.
We put it with the bone graft, and it makes what's called sticky bone.
So you soak it in here?
Sorry. So just to make things simple, the patient's blood is being drawn. That's simple.
Like how the plastic surgeon or the
phlebotomy. It goes into a centrifuge. Then it's being spun in a specific, speed.
Like regular PRP procedure. Right?
It's more PRF. It's PRF, platelet-rich fibrin, not PRP. Because PRP, you need to use the antithrombin, so it doesn't clot. We don't use it because you use it quickly. We process the patient's blood. We actually borrow the patient's blood, and we're going to give it back to them. Right?
Interesting.
And we process it for liquid, so it's called PRF liquid. We process it for membranes, basically almost like bandages that can drape a wound, because in the mouth you can't put bandages, obviously. So you need to use those custom-made bandages from the patient's own blood. And we process it as plugs. So depending on the procedure, for example, if you're doing an extraction, you're pulling a tooth, you're left with a big crater in the jaw. You're not going to leave it open. You want bone to grow in there. So we take that liquid with growth factors, mix it with particulate bone graft. And then that concoction, Dr. Herman mentioned sticky bone. Why? Because it sticks. It becomes like Play-Doh. And we can pack it, we can build up the bone, so there's laid-on bone for dental implants, for example. So that's used all the time. We use things like platelet-derived growth factor. It's called GEM21. That is a product which makes blood vessels grow quickly.
This is not standard of care.
We've been using it for 15 years in our practice, so we've been doing this for a very long time, but it's not, actually I think it is the standard of care. I think not in the conventional sense where everybody needs to use it, but I think it should be the standard of care, because if there's something as simple as drawing the patient's blood and spinning it in your office.
Because I have not heard of it that often, where they're drawing your blood in a dentist's office.
I mean, Dr. Herman is very good at blood draw. I'm not. So I always bring a phlebotomist unless he's in the office. But somebody draws the blood.
we know who to borrow when we don't have a phlebotomist.
He's going to poke you once. I'm going to poke you twice.
One of the funny things, like just as a side note,
Right.
You get to learn about like I like doing it for my patients just because I get to know, do they have good blood vessels or not? So sometimes,
What does that tell you?
sometimes it can tell me a little bit about their healing, because if they have hard blood vessels.
And the color of the blood as well.
Yeah.
What's the color of the blood? Is it more red? Is it more cyanotic, meaning more bluish? You know, you can tell by the color of the blood how much oxygen is it? Not in a scientific way.
No, but in a healing way. Like, see, why back in the day, why would the doctor see your tongue? Why would they see the color of your nails? Like, it's observation. Like, otherwise you can be seen by a robot, right?
Exactly.
This is called the human interaction.
Yeah.
Yeah. And that's what's lacking in a lot of, like I just had a physical, and I mean, it was kind of like, okay, what?
Well, you have to come back into the physical at Sydenham, the Sydenham way, because again, like, it's a relationship. It should be like 2 hours long, where you're talking and you're telling your doctor everything from like your life stresses to your marriage to your sex life. Everything should be out in a doctor's office. Well, this has been extremely exciting. I'm being told we're really going over time, and I need to.
There was actually a good transition when you
Yes.
mentioned sex life. You mentioned.
Oh yes, oral microbiome.
Everybody's going to perk up and like, what's next? I think something a lot of patients are worried about
Right.
is STIs, sexually transmitted infections through the mouth, because that's a very intimate connection between people. So as dentists, especially as dental specialists, we can see certain signs of STIs. And the most common one that people know about is the HPV, the human papilloma virus.
Right.
And part of our exam is a complete intraoral exam where we look under magnification, and occasionally we would see small little dots on the gum or on the palate or on the cheek or on the tongue. And if you don't have that training to diagnose it, then you would just let it go, and patients walking around with an active HPV. So what's the big deal? Well, it's a big deal because HPV is a type of virus that can cause changes in cells, and some of them can transform into cancer. So when you see something suspicious, you know, if you feel something in your mouth, want to speak to your dentist or your specialist and get a biopsy, get it out. And
This is what we mean by early detection and prevention. You know, if a dentist had this little bit extra attention, you know, we could detect so many cancers in your office.
Yeah, and we deal with cancer.
So
as well.
why don't we make that the first question? So is oral sex hot or not?
Of course it is.
Outdated? Is it out because we have too much information?
I think it's preference
I think
of the user.
I think
Is it dentist recommended or not?
it's very
Have your partner tested. if
Under supervision.
Yeah, exactly.
Okay, so we go into hot or not section.
Okay.
The first one. What's your verdict on oil pulling?
I think that it's time consuming. I think it's hot. It's a hot topic, but do you have that much time in your day?
hot. I don't do it.
Okay. Tongue scraping. I think you both did good.
Hot.
Very hot.
Should do it, but with the right trunks.
Yeah.
With the right tools.
Yeah.
Charcoal toothpaste.
I don't know. I don't have much of.
Not hot.
Yeah.
Fluoride toothpaste.
I don't see the necessity these days.
If you're prone to cavities,
Yes.
I think it's hot.
Again, one size doesn't fit all, right?
But I think there's other ways to deal with it. If you're prone to cavities, you can change your diet. You can change, you know, a lot your microbiome. So I don't believe in that one anymore. I think fluoride kills the good bugs.
The good bacteria.
Yeah. So I'm
not hot.
Yeah,
Not hot.
for me.
Okay. Water picks and water flossers.
Hot.
Yeah.
Hot. Yeah. Anything to help with oral hygiene,
Right.
especially if you're not a flosser. Sorry, not everybody flosses.
Right.
If you're not a flosser, get a water pick. Pretty good.
Morning, evening? Or
Definitely evening. Definitely
Yeah,
evening.
after
Definitely.
Evening is the most important because that is when you have the least salivary flow. So you're the lubricant that helps to prevent cavities, helps prevent all the buildup in your mouth. So
I'm sure we wake up with some good bacteria too, right? It's not all bad.
depends.
Again, depends what you eat, what you got, of course.
Well, the bad breath in the morning
Yes.
is bacterial.
Yes.
because the bacteria overgrows. There's no halitosis, bad breath. There's no body odor without bacteria. That's what causes it.
Yeah.
So
Yeah, all gum.
remove all of it.
That could be early signs of gum disease, inflammation.
And on that note, it was funny because a long time ago, I didn't think of it. And I would recommend a mouth rinse with alcohol in it to patients and all this. And a friend of mine said, you know what? I noticed that when I used the mouth rinse a lot, all of a sudden I get worse breath and it would come back faster. So they were realizing 20 years ago or more that was throwing off their microbiome. And I didn't put two and two together because I wasn't knowledgeable enough at that time.
Thank you for being so open-minded. The last one in a hot or not section is chewing gum and all these different, chewables that are there to balance out your oral microbiomes. Any verdict on that?
I mean, chewing gum in general to me is hot because it stimulates saliva flow, and saliva is a great thing, number one. However, depending on the gum, there's a lot of, it has to be sugarless, number one. If you chew it too much and you're prone to TMJ issues, you might aggravate the muscle tension. And it's not the most polite, but I'm addicted to gum, like everybody knows, and he gets me healthy gum.
Yeah, no, I think
what's the gum that we just tried today?
No, that's a probiotic.
We have a probiotic, prebiotic gum.
Yeah,
that's great.
Prebiotic to help you with nitric.
Well, that was going to be my last question. Yeah. What is your one health tip for people that you both practice, and what you think is an anti-trend that you would like to steer people away from?
Well, I mean, one thing that a lot of people are doing these days is vaping.
Yes.
And vaping's not good at all. So that's probably one of the things that I would discourage people.
From an oral health or overall health?
Everything. Vaping is probably the new cancer causing that we were going to see, because our kids, not my kids, thank God.
So addictive.
Our kids, or kids in general, are starting to vape at 12 years old, and they're getting the amount of nicotine of 2 packs in a couple of puffs.
And the chemicals,
plus all the carcinogens inside the vape and all that stuff. Says, you should watch the documentary about the big vape. I mean, the marketing of vaping is incredible. The marketing, but they're marketing poison. Okay,
but it's so addictive. Yeah, I think you try it once.
Then it's like the nicotine. Yeah, you get a nicotine boost in your brain, but it's one my first
So let's end with the health trends. Health hacks.
For me, my first meal of the day is lunch. So it's my favorite meal. It can be a small thing, it can be a big thing, but it's my favorite meal. And after that meal, I go for a walk in Beverly Hills. You'll see me walking the streets.
Yeah, come visit us.
I'll come visit you, except when I have a podcast. I skip that. But we walked here, so that's my thing. Walking is, as somebody who loves to work out, walking is probably one of the healthiest things that you can do.
Yes.
And it's underrated.
No, and the Blue Zones really got this out, natural movement.
Yeah, and I agree. I mean, the intermittent fasting I do, but one of the things that I find that really helps me in the day is starting my day with a glass of water. And
hydration.
Yeah, hydration, because you've been sleeping all night, and hopefully sleeping, and you're drying out your mouth, you're losing water, and so it's important to rehydrate in the morning, and we don't realize most of the time that we're so
simple things.
Yeah.
Well, thank you. I'm sure we're going to have them back for a second podcast just when their book comes out. But thank you so much. I mean, we could go on, and really fortunate to have you. We're in the same community, we have the same mindset, we're trying to drive the same mission. And thank you for all the good work you do.
Thank you. Thank you for having us.
Yes. Thank you. And yes, Miss Chloe, I wish we got a little close-up of her. She was our special guest today on the podcast.
She's so sweet.
Good morning. Are you awake now?